Type 2 diabetes wounds do not heal with type 2 diabetes people. There are many complications related to this disease. What is type 2 diabetes? Diabetes is a condition where a person has a poor insulin sensitivity. As a consequence, glucose distribution affected glucose stays in the bloodstream long, that is causing sustained high blood sugar levels initially. A person with diabetes develops insulin resistance in the body and needing more insulin to deliver the same amount of glucose to organs. In other words, body tissue needs more insulin in order to take glucose into cells subsequently. Pancreas, that is a gland that is responsible to produce insulin, increases insulin production to match body's resistance. This is where the oral medications increase response to insulin are effective. In the later stage, pancreas reached its upper limits in terms of insulin. Pancreas reached its upper limits in terms of insulin production, where no longer can keep up with the insulin demands of the body. That is called pancreas burnout. In medical terms, pancreas goes from compensated production to state of decompensation, and insulin starts to decline. That's where tablets for increasing insulin production are used in addition to sensitivity enhancers. How resistance to insulin starts. Human body has three main types of tissues: bones, muscles, and fat. Main tissue where insulin resistance developed is fat, where muscle, being metabolically active and improve insulin sensitivity, fat tissue requires more insulin to take up glucose, subsequently forcing pancreas to work harder. This is the reason that obesity is the main risk factor of diabetes mellitus type 2. Another factor is sedentary lifestyle and poor eating habits. Inactive lifestyle increases insulin resistance, while aerobic physical activity improve insulin response significantly. Eating high-carb diet, especially simple carbs, increase blood sugar, rapidly stressing pancreas. Unnecessarily, insulin is produced and then delivers sugar into organs, and excess sugar is deposited around the intestines and underneath the skin in the form of fat. Eating complex carbohydrates and high fiber foods will improve glucose distribution and lessen the fat deposition. Each type 2 diabetes curable. Initial stage of diabetes caused by increased demand for insulin due to poor sensitivity, therefore improving sensitivity before pancreas burnout happens, then can reverse the diabetes type 2. Cure is possible. Why insulin production is normal to high and body has excess fat tissues. Obese people can reduce body fat %, establish active lifestyle, and improve eating habits in order to reverse diabetes. If pancreas has lost capacity to produce enough insulin, then person may require lifelong medication. What foods can help with diabetes? Foods with low glycemic index are helpful with diabetes type 2. What is glycemic index? It is how quickly blood sugar is raised in a given food. Some foods increase blood sugar fast, requiring fast and more insulin production, meaning these foods have high glycemic index. Those are white foods such as pasta, rice, bread, have glycemic index around 50. In contrast, cauliflower, broccoli, eggs, and meats have around 0 to 15 respectively. If consumed, former blood sugar rises higher and faster than the latter. Therefore, food selection is important in diabetes patients.